Hello and welcome to Swaay.Health. I'm Colin Hung and I'm here in Nashville, Tennessee for the Marketing360 Summit. This summit, it's the first time it's being held, and it's bringing together agencies, provider-based marketers, and technology companies to really share and learn from each other around things like AI, around HR and marketing, and around the latest technologies and trends in the provider marketing side. I certainly enjoyed being here, but I'm going to let a few folks tell you what they thought of the conference first. Let's get to it.
Hello there, Kirsten Leckie here from Writer Girl & Associates at the Marketing360 Summit in Nashville. It's been a great conference. I've really enjoyed and appreciated a lot of the sessions around the relationship between marketing and human resources. We heard a lot of great content from both Amy and Christine, just talking about connecting brand to culture to improve patient experience and, of course, create a culture that fosters loyalty among employees and translates into a better experience for patients. Kier from Merge had a great session on AI. So not only a whole glossary of terms, but a really kind of scary video on how AI shows up in robots. And so lots of things for us to look forward to. But it's been a great conference and I'm happy to be here.
Hi, I'm Katie. I'm a marketing and content strategist from Smith & Jones. Something that we're always talking about is patient journeys. But one thing that I think is important that they talked about at the conference is that no patient journey is exactly the same. Everyone's is going to be a little bit different. So there is no one patient journey. However, you're going to want to identify the pain points that are consistent with every patient journey and address those pain points to make the process easier. And once you've identified those pain points, think about the jobs to be done for each patient. What are they actually trying to accomplish? It's not just trying to find a doctor. It's I have a problem or I think I have a problem and I want to figure out what's going on. How could this affect my life? So think about those questions that the patients are actually thinking about and going through rather than making sweeping generalizations or just thinking they just need to find a doctor. How do I get them to do that?
Hi, I'm Jared Johnson. I'm the founder of Swaay.Health. It's a consumer advisory firm, and I was the chair of this inaugural Healthcare Marketing 360 conference this week in Nashville. We had a lot of fun. It was really felt like a group of friends and family in a setting that made it very easy to engage and talk and interact, and that was a lot of fun. There were a couple of takeaways for me, though, that I didn't know what to expect in terms of what would stick with me, and there were definitely three that stuck with me. The first one was the thought of overcoming healthcare sameness, of finding new ways to differentiate a brand where the fact is a lot of the tech stack that's used in marketing and outreach is the same or similar. It's not different types of features, so that's not how health systems and provider organizations are differentiating themselves. So overcoming that healthcare sameness is essential, and it should be a priority. Then we also talked a lot about marketing's role in recruiting and retention of talent, not just in their little spot of the world, but the clinical retention and talent management that's needed for provider organizations to really do their work. And I thought that was a great theme because we don't hear that much about that, and there's a lot of work. It was great to shine a spotlight on some of that work that's being done. And then finally, we did talk about kind of the next generation of where consumer strategies do overlap with a lot of marketing outreach and campaigns. And yes, we're being informed by better insights, but that means a lot of different things. It all comes back to creating healthcare experiences and services that people actually want and not trying to just get them to want the things we're already providing. It's a different way of designing things. So I enjoyed all that. And yes, we did talk about AI, it was there. And I thought a really good summarized way that talked about practical applications of it specifically for marketing. So yes, I feel like there was a lot of topics covered and really look forward to seeing where the conference goes from here.
Hey, I want to thank everyone for coming on camera and giving us their thoughts and their recap of this wonderful Marketing 360 Summit. For me, one of the big takeaways is how all of us in marketing are really struggling with and challenged with attribution. And what I mean by that is really proving marketing's value. Marketing has always been one of these departments where it's viewed as a cost center. So we have to work extra hard and making sure that the work we do is tied directly to either growth or revenue generation or some metric that's recognized by executives as helping to grow the organization. The one takeaway from this conference is that from the provider side, one of the better ways to really prove marketing's value is showing the attribution of marketing to HR. And what I mean by that is there were a number of presentations here that was talking about marketing's efforts to improve and streamline the recruiting of staff, whether that's clinicians, nurses, physicians, all of those people. It was very easy for marketing to tie the number of applications, the number of hires directly back to marketing programs that were centered around promoting the organization. That type of attribution can really help to justify why marketing is spending and doing what they're doing. Whether that is an email campaign, a brand campaign on local media, or an email campaign, or even Google, Instagram, and social media campaigns. That to me is my key takeaway, and that is something that I'm going to be definitely bringing forward as well, is talking about how provider-based marketers can really get together with their HR teammates to really promote their organizations. And hey, if you enjoyed this as much as I enjoyed it, please like and subscribe. Also, head on over to Swaay.Health, that's Sway with 2 A's, .health, where you can find more great content like this. I'm Colin Hung, thanks for being here, and I'll catch you on the next episode.